In What's New in Medicine today, if you're a woman feeling sluggish or having trouble sleeping these days, you might want to ask your women's health provider about a common hormone women don't talk much about, testosterone. We often hear about it as the hormone guys boost to feel better. But if you've noticed everything from changes in your skin you can't explain to moods that seem to match the dreary weather this time of year, there's something you should know.
It's a big myth out there that testosterone is just for men. In fact, when women in their 20s, we actually have 10 times more testosterone circulating in our body than estrogen. So testosterone is a female hormone as well.
Dr. Amy Brenner is a women's health specialist who told me a variety of things can influence this important hormone in women.
It has so many effects in our body. It's not just about libido and sex, but it can affect your mood, it can affect your sleep, it can affect kind of just your overall well-being with fatigue, aches and pains, recovery from exercise, skin health, bone health. So it has a lot of functions in our body.
So what's important to note is you may not want to wait until you're feeling some of these symptoms to come in and see your women's health provider. You might want to sort of track your hormones along the way.
There are certain medications or lifestyle changes that can deplete testosterone. Otherwise, typically age is the most common factor where we see testosterone levels decline. But pain medications can affect it, cholesterol medications can affect it, because that's where testosterone comes from, is the cholesterol molecule.
If these are part of your history, you can be treated, if needed, with testosterone in topical treatments, injections, or even in a pill. And joining us now, Dr. Amy Brenner, Amy Brenner and Associates. Good morning to you.
Good morning. Thanks for having me.
Now, just to clarify, you said that the pill actually is something that you implant, or how does that work?
Correct. So I don't like to give testosterone as a pill, but it can be used as a cream, an injection, or something that looks like a pill, but it's actually a subdermal implant that goes under the skin and releases a steady state of hormones over the next few months.
And then you absorb them appropriately?
Correct.
Yeah. So this was so interesting. We aired this story. Both men and women were like, we had no idea. Like, you just think of it as a guy's thing. So I guess probably that when I look at that list of symptoms, any one of us could have several of them on a given day. So what is it that you sort of share with people about these now?
So you're right. Sometimes the symptoms can overlap with other hormone issues like thyroid or adrenal or blood sugar issues. So it's really important to take a full medical history, physical exam, and along with a full hormone panel to see if testosterone may be right for somebody.
So I thought what was interesting was when we talked, you said hormones got a bad rap. How come, why, what are we afraid of, what happened?
Right, so that big study, the Women's Health Initiative in 2002 that, we'll say that was on hormones, but you and I mentioned is I consider the drugs that were in those study of pharmaceutical drugs, of Premarin, which was made from horse estrogen, and something called Prempro. And just in general, people just now refer to all hormones as hormones, and they're referring to that bad study. But when you really study the literature, hormones just, or bioidentical hormones of what our body naturally makes, just does so many great things for our body. So the pendulum is starting to switch, and people are realizing that hormones do a lot of great things for our body, but some pharmaceutical drugs, I call them hormone imposters, they're just not the same thing.
And we have a little video of your office. I know people come in with all kinds of things, and so I guess how then would I separate, hey, Dr. Brenner, I need to tell you I've got these symptoms, or maybe even how do you separate if I come in with those, because like you said, you want to make sure I'm on the right stuff.
Yeah, so in general, I personally, in our practice, we don't ever prescribe the hormone imposters when bioidentical hormones are available now in 2020. So that's the first thing. And then the second thing is going to somebody that's really an expert in the field of bioidentical hormones. Not everybody out there specializes in that, and understanding the data can be very confusing, even for a physician that has training to evaluate the medical literature.
And one of the reasons I appreciate this partnership is I know you do stay up on those. You do a lot of continuing ed, and I have seen that sort of change as we learn more about these. So just real quickly, we have a graphic. I just want to remind people what some of the symptoms are that you might say, you know, these are things you could come talk to me about or something. So what is it that impacts like your desire and your mood and your satisfaction, your weakness? Is it all of the testosterone just not being where it should be, or?
So certainly that's a part of it. It's testosterone, as you spoke with other people on your show today, is there's a lot that goes into mood, libido, that type of thing. Relationship status, your overall health status, but certainly testosterone and all of your hormones also play a role. So it's just one piece of the puzzle, but it's a big piece of the puzzle of having optimized balanced hormones.
No, I appreciate that you look into that, because otherwise I think we just think it is all in our minds. You know, and as you mentioned, probably age, things change, and it's okay to say, I don't feel quite like I used to, and then people just go, oh, but maybe not, huh?
Yeah, you know, as our car ages, our house ages, it's perfectly acceptable to replace a rusty car or paint a house that has chipping paint. But sometimes people are told that just age gracefully, and now with the technology and things that are available out there, you don't have to just accept like it's just part of aging.
Right, and I think that is probably the most important message. If you hear nothing else, hear that, you know, that at least ask the question. Maybe, you know, there are some things that aren't going to always be perfect, but if it could get better, that's what I watch you do that and change women's lives all the time, and that's just what we love, yeah.
We are changing lives, and it's really fun to come to work.
I bet, because people come in and say, hey, thank you for that. Well, Dr. Amy Brenner, always a pleasure. Always learn something from you.
Thanks for having me.
Thanks for sharing the tough stuff with us. You know, these are subjects that are tough to talk about, but people do appreciate it. And if you'd like help for your hormones, for energy levels, for other things, Dr. Amy Brenner's practice has a link with us. Just go to local12.com and click on what's happening in health. Thanks for being here today.